All right, Myra's off today, so I guess for the next 6 minutes, I have a doctor as my co-anchor. Dr. Amy Cobb joins us with University Health. We are taking your questions to the experts. Thank you so much for being here with us.
My pleasure.
All right, so the first question has to do with diabetes. I've been losing a lot of weight, but diabetes runs in my family. What are some of the steps I can take to see if I am possibly diabetic?
Okay, well, first of all, I want to congratulate this viewer for losing some weight and being proactive about getting screened. So there's actually, I think the best way is to go to your provider and get the screening done there, because there's likely other stuff that he's going to be due, or he or she would be due to be screened for. But you could do this at home with a glucose monitor that you can get at any pharmacy. So if you're having symptoms, which would be hungry all the time, thirsty all the time, needing to pee a lot, losing weight without meaning to, or not actually doing anything where you should be losing weight, blurry vision, and you have a random sugar, potentially. Now, if you have no symptoms and you just want to be screened, there's three main ways. The most common way would be a fasting glucose, which means you don't eat for 8 hours and then you have your sugar checked. If that number is over 126, then that could meet criteria. We've talked about the hemoglobin A1C on this segment a few times. That's your report card or average sugar over 3 months. If that number is above 6.5, that could meet criteria. And then there's this other test called an oral glucose tolerance test. It's not fun. You swallow something really sweet. They check your sugar a bunch of times over a period of hours. And if it meets certain criteria, you could have diabetes. Now, if you don't have symptoms, you actually have to have 2 tests that meet criteria to have the diagnosis. So it could be a fasting glucose and an A1C the same day, or maybe an A1C on 2 separate days that meet criteria.
But just the fact that this person is losing weight, if they don't mean to lose weight, if they're not working out, if they're not on a diet, that could be a symptom.
Could actually be a symptom.
All right. Now let's go to the next question. What are diabetic neuropathy symptoms and how can they be treated?
Yeah, so diabetic neuropathy happens when you have diabetes that's uncontrolled for a long time. And there's actually a lot of different types, and I think many people aren't aware of that. So most people, when they talk about it, are talking about peripheral neuropathy, also called length-dependent neuropathy. So those long, thin nerves furthest from the spinal cord will be affected first, which is why you often start with a tingling in your toes. It goes to the soles of the feet and then goes up the leg. We say like a stocking being pulled up. And that can cause you not being able to feel if you have a pebble in your shoe. And that can lead to ulcers and wounds. You may not be able to feel your body in space. You may be more likely to fall. You can lose muscle in your calves and your legs. Another type of neuropathy is called autonomic neuropathy. And this is under-recognized, but I actually see it all the time. It's when you start to feel like that dyspepsia and constipation, your gut's not moving. It can also cause you to sweat inappropriately or have a fast heart rate. And then there's mononeuropathy, which means just one nerve is affected, and that's things like Bell's palsy, which we've discussed, as well as carpal tunnel syndrome. So it depends on what type of neuropathy, what the treatment would be, but the basics would be, creams and patches for some types of neuropathy, like the ones maybe on your feet. You could take some pills by mouth. You want to make sure that you're wearing well-fitted shoes that are laced up, that don't have open toes, that are well padded, so avoiding your sandals and Crocs, that sort of thing. You're going to want to look at your bottom of your foot every day, so if you can't actually pick up your foot, you're going to put a mirror and then look at your foot underneath to make sure there's no wounds. And then you may need a cane or a walker if you're off balance. And the other thing I would say is that an ounce of prevention is worth a pound of cure. So you just want to get those sugars under control as soon as possible.
Yeah, and diabetes is such an issue in San Antonio and South Texas. If you think you may have it, get tested. If you have it, get treated.
Yeah, make sure you're doing all of that preventative maintenance stuff that you have to do for diabetes. You don't get the diagnosis and then stay home. You got to see your doctor regularly.
Yeah, absolutely. All right, next question. Is a non-mRNA COVID vaccine available? If not, do you have any idea when?
Yes, it is. The brand name for the non-mRNA vaccine available in the U.S. is Novavax. It was approved, the updated version was approved in October 2023, and it is widely available. It's for 12 and up, 12 years old.
Okay. Now, is it as effective as the mRNA? The tests, are they?
Yeah, it has different pros and cons. So just briefly, an mRNA vaccine is using the body's own machinery to stimulate your immune response. That's what mRNA is part of your own cell's machinery, versus, Novavax is actually making a protein that looks like the COVID vaccine or the virus and injecting it, which is kind of an older technology, but they both are highly effective. And I would encourage you, anyone you're comfortable getting, go out and get it.
Yeah, just get it.
Just get it.
Yeah. Final question. How common are miscarriages?
Yeah, so the ACOG, which is the American College of Gynecologists and Obstetricians, says that early pregnancy loss can happen in up to 10% of clinically recognized pregnancies, and about 80% of those happen in the first trimester. What I really want to emphasize is that most of the time it is not anything that the woman did that caused the pregnancy loss. Almost 50% of the time it's actually a fetal factor, like a fetal chromosome or a DNA problem with the developing fetus. And I actually don't like the term miscarriage because it implies that the woman did something wrong. She miscarried the baby, but really that's not the truth. And the other thing I want to just mention is that a lot of people, both the woman and her partner, may be experiencing a lot of isolation after a miscarriage. And I think that's partially because a lot of people don't announce a pregnancy until the second trimester. And so people don't even know that there was a pregnancy. And then it feels taboo to talk about it a lot of times in our society. But the silver lining here is that of those who have experienced a miscarriage, 85% go on to have a successful pregnancy. And those who have had 2 or 3 miscarriages, 75% go on to have a successful pregnancy.
And one of the reasons we ask this question is because of the stigma that's out there.
Right.
And our Stefania Jimenez has been very open with the fact that she suffered a miscarriage and that she has been dealing with infertility issues. She's actually having a live stream right after this newscast on KSAT Plus, on our YouTube page, and KSAT.com. So be sure to stick around right after this newscast. As a matter of fact, at the end, we're going to have a conversation, but hopefully we break down some of the stigma and figure out a better word than miscarriage.
That's right. Pregnancy loss.
Pregnancy loss. I like that. Dr. Amy Cobb, University Health, always appreciate your time.
Thank you.
If you have a question for one of our doctors, we want to see it. You can use this QR code to submit that question.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.